Kailangan ko ng trabaho, bakit wala pa akong trabaho? Bakit hindi ka pa nag-a-apply sa PhilTA? Nag-hire kami ng mga developers, graphic designers, digital marketers, admin at iba pa. Kaya ano pang hinihintay mo? Mag-apply ka na!
You for an online interview. How do you prepare? First, download the needed software. Make sure that you're familiar with it and that you can use it on the day of your interview. Number 2, dress professionally. Smart casual is always a good idea. So wear a nice polo, nice blouse, a nice pants or skirt, and make sure that you'll do your best during your online interview. Number 3, clear your workspace. The clutter in the background doesn't have to be seen by your recruiter. Number 4, make sure that you're in a quiet room. You don't have to be disturbed by people, your pets, or any background noise. You have to focus during the interview. Number 5, make sure that you have a pen and paper nearby in case you need to write something down. Number 6, make sure you have a copy of your resume nearby. Last but not the least, smile and focus. You got this!
Oh yeah, oh yeah. Dance under the sun, feel the breeze of the ocean. Dance under the sun, feel the body in motion. Dance under the sun, feel the breeze of the ocean. Dance under the sun, feel the body in motion. Move your body, shake the bum. We can do this all night long.
Baby, work it. Baby, work it.
Hi everyone, my name is Narissa Show. I'm the co-founder of Filter. Love to have you on board. Please apply to careers@filterglobal.com.
Feel the same $1 million babe, tripping on it like propane.
Beautiful. Look it, look it, look it, look it, look it, look it. Unlock it, look it, look it, look it, look it. Got the key, can you unlock it? Look it, look it, look it.
I am Iris, a technical recruiter in PhilTA. PhilTA specializes in e-commerce and digital marketing agencies in Australia, US, and UK. Right now, we are on the hunt for back-end developer who has experience in Python and Django, and full-stack developer who has experience with Python, Django, and React.js. So, are you interested? Just send your resume here, or earn as much as 10,000 pesos if you refer a friend.
Kailangan ko ng trabaho, bakit wala pa akong trabaho? Bakit hindi ka pa nag-a-apply sa PhilTA? Nag-hire kami ng mga developers, graphic designers, digital marketers, admin at iba pa. Kaya ano pang hinihintay mo? Mag-apply ka na!
What kind of drink can be a sweet dream or a beautiful nightmare? Either way, I don't wanna wait.
Call you for an online interview. How do you prepare? First, download the needed software. Make sure that you're familiar with it and that you can use it on the day of your interview. Number 2, dress professionally. Smart casual is always a good idea. So wear a nice polo, nice blouse, a nice pants or skirt, and make sure that you'll do your best during your online interview. Number 3, clear your workspace. The clutter in the background doesn't have to be seen by your recruiter. Number 4, make sure that you're in a quiet room. You don't have to be disturbed by people, your pets, or any background noise. You have to focus during the interview. Number Number 5, make sure that you have a pen and paper nearby in case you need to write something down. 6, make sure you have a copy of your resume nearby. Last but not the least, smile and focus. You got this!
Oh yeah, oh yeah. Dance under the sun. Feel the breeze of the ocean. Dance under the sun. Feel the body in motion. Dance under the sun. Feel the breeze of the ocean. Dance under the sun. Feel the body in motion.
Your body, shake the bum. We can do this all night long.
Baby, work it. Baby, work it.
Hi everyone, my name is Narissa Show. I'm the co-founder of Filter. Love to have you on board. Please apply to careers@filterglobal.com.
You feel the same $1,000,000 bag, tripping on it like propane. Beautiful. Look it, look it, look it, look it, look it, look it. Unlock it, look it, look it, look it, look it. Got the key, can you unlock it, look it, look it, look it.
Everyone, I am Iris, a technical recruiter in Filta. Filta specializes in e-commerce and digital marketing agencies in Australia, US, and UK. Right now, we are on the hunt for back-end developer who has experience in Python and Django, and full-stack developer who has experience with Python, Django, and React.js. So, are you interested? Just send your resume here. Or earn as much as 10,000 pesos if you refer a friend.
Happy Monday, it's the start of a new week. I hope that you're all well and in good health. Speaking of health, we have invited Dr. Hershey Dela Cruz Valenzuela as a guest speaker to present an insightful Facebook Live topic entitled Infodemic, Awareness and Coping Strategies Against COVID-19 Virus. This Facebook Live event will be on Tuesday, May 11 at 6:15 p.m. Invite your colleagues, friends, and family, and I look forward to seeing you there.
Hello, hi everybody. Thank you for joining us. Hope everyone's doing well. Welcome to tonight's Facebook Live event. This is a very exclusive one and quite unique as well. We're doing a hashtag #FiltaCares. So if you're here, do mention where you're coming from, or if you want a shout out. Let's see, we have Romel, we have Geraldine in the call for tonight's webinar. Perfect. Thank you guys for joining us. Again, for Filta, we are an offshoring company and we cater specifically to e-commerce merchants as well as digital agencies based in Australia, UK, and in the US. We also have accounts in Canada. From our end, we are currently in search or in need of digital marketing specialists, CGI designers, FB ads specialists, SEO content writers, Shopify developer, and React.js developers. So if you're looking for job opportunities, we are hiring various developer, designer in digital marketing, admin, and back office roles. Feel free to visit www.filtaglobal.com/careers. So you may also refer people you know and earn up to 10,000 for this referral program. Again, for tonight's Filta Facebook Live event, we will be giving out e-certificates. Registration form will be provided in the comment section anytime during the Facebook Live. All right, is everybody in? Again, thank you so much for joining us. Hello, Erica. Hello, Shama. Who else do we have for tonight's Facebook Live? All right. Awesome. Okay, so let's start. For tonight's webinar, we are going to talk about awareness and coping strategies against COVID-19 virus. We have invited Dr. Hershey Dela Cruz Valenzuela, who is an enthusiast of public health awareness. Having been exposed to various hospitals during her training years, both DOH and public hospitals and private hospitals, sorry, she has also envisioned herself as a passionate and committed to give an utmost and holistic care to her patients. She is a new passer of the Physician Licensure Examination and is currently practicing as a general physician in private hospitals and clinics. She is also affiliated in the city health government of Valenzuela, taking a crucial role as a medical officer and physician for the execution of COVID-19 vaccination rollout plan. So without further ado, I bring you Dr. Hershey Dela Cruz Valenzuela. Doc, sorry,
Hi
you're on mute. There
everyone.
you go.
Okay, I'm good. Hi
Hi.
everyone. Good evening. I'm Dr. Hershey Valenzuela. So I hope everyone is well and good right now. It's the second day of the week. I hope everyone are safe through their homes, no?
Yep. And we're all excited to have this presentation. Of course,
Yeah,
everyone's really talking about vaccines or
yeah,
and any form of information is always welcome. So
yeah, yeah.
if everything is all set, Doc, you can try sharing your screen now and so that I
Okay.
can turn the floor to
Yeah.
you.
All right.
Again,
So
again, everyone just invite tag your friends,
friends
continue
and
inviting people.
families, because
Yes.
this is really a relevant issue, no? Especially right now, it is really a great time for us to talk about any related issues about COVID-19 virus, especially nowadays that there are a lot of misleading informations, right?
Hmm.
We have a lot of fake news out there that make all the people, the patients, be
Yes.
hesitant to
Mm-hmm.
get the vaccine,
Yep.
right? Okay, so let me just share my slide and let's start. Babe, how can Okay, is it on already? Can you see it? Babe, how can I full? Paano mag-full ano to? Paano wala?
Hi everyone, sorry about that. We are experiencing some technical difficulties in terms of the loading or uploading. So what will happen now is I'll be just sharing my screen, and then Doc will just talk over it. So on. Mhm. There we go. All right, Doc.
All right, let's go. I'm sorry for the technical difficulties. Okay. All right. So again, good evening, everybody. I am Dr. Hershey Dela Cruz Valenzuela, and I am currently affiliated to City Health Government of Valenzuela City. And I am specifically engaged in the execution of COVID vaccine, no, in this LGU. And right now, it is really a great timing for us to talk about vaccination awareness and coping strategies against COVID-19 virus. It is going to be an infodemic. All right. So without further ado, let's start it. For the next slide, please. Thank you. Okay. So there will be 4 categories of questions. No, first, we will be having vaccine-specific questions, vaccine use on vulnerable populations, the potential of transmitting COVID-19 after vaccination, gaano ba ka-effective yung magkaroon ng bakuna, meron bang tsansa na makapag-transmit pa rin tayo sa iba o ma-infect pa rin tayo ng COVID-19 even if we already have the vaccine, no? And then we're gonna be talking about the common side effects of the vaccines that we have here in the Philippines. Next slide, please. Okay, so what vaccines are currently available in the Philippines? All right, so what we have right now, we all know that we have AstraZeneca and Sinovac. AstraZeneca, there are different kinds of mechanism of action. No, AstraZeneca, it is a viral vector. It uses harmless virus, which is inactivated, and then they put a part of a COVID-19 genetic code in there, okay? While Sinovac, it is really the COVID-19 virus. It is a whole virus that is inactivated and weakened. And then it has been inoculated in our body so that our body could recognize it, and then antibodies could form, no? We also have RNA nucleic acid. Next slide, please. That is Pfizer and Moderna. Ito yung bakuna na talaga namang hinihintay ng lahat, no? A lot of people are waiting for this brand because, as they say, maganda daw. And later on, we're gonna be discussing ano ba yung differences nilang lahat. Pare-pares lang ba sila ng efficacy? Are they gonna be helpful for everyone in terms of preventing the virus, no? Okay, so next slide. Okay, so ito na nga ang question ng lahat. Doc, is there a best specific vaccine brand for Filipinos? So here, a lot of people, a lot of patients are very hesitant to be vaccinated. Why? Because they're waiting for a specific brand. So what we have currently is Sinovac. Yan yung pinakamarami na meron tayo. AstraZeneca has been administered already last month, and then because of some research results and research findings na pull out siya, no? So ang sagot dito is that whatever is available, that is the best vaccine for you. It is not really race-specific. Once the vaccine has passed the clinical trials, kasi dumadaan yan phase 1, phase 2, phase 3 before yan mass vaccination eh. Once the vaccine has passed the clinical trials, then it has a good efficacy already. All the vaccines have prevention in getting or preventing severe complications, no? Example na lang, it is always a case-to-case basis, all right? It depends upon the health background of the patient. There are young people without comorbidities but weren't able to survive because the patient might have a weak immunity. So, say for example, this sa AstraZeneca, no, there are findings na blood clots daw to less than 60 years old and below. And then the ratio for that is that 3 persons into millions of people. So, it's gonna be a very low probability, no? So, who knows that 3 persons, they are really they have a special cases. Say for example, they have blood disorder, hypertension that they don't know, they don't get to go to their personal doctors, or they weren't able to, take their medications. That's why they got blood clots, no? So, pare-pareha lang yan. Yung mga vaccines natin, they are meant to prevent severity of complications ng COVID-19. Pare-parehas lang siya na once they have been introduced to our body, they will strengthen your immune system. They will create antibodies for us to be immune. All right? So next slide, please. Okay. What is the main purpose of getting the vaccine? Kapag ba nabakunaan ako, Doc, hindi na ako magkaka-COVID? Kapag po ba nabakunaan ako ay may chance pa rin na makapag-transmit ako sa ibang tao ng virus. Okay? So the main purpose of the vaccine is that it will strengthen your immune system. There is no 100% assurance that you cannot get COVID-19 after being vaccinated. Wala sa kahit na anong vaccines that available vaccines that we have right now that would say na hindi ka na magkakaroon ng COVID-19. So basically, pare-pares lang sila na ang target nila is to just, strengthen your immune system. So whether it is AstraZeneca, Sinovac, Pfizer, or Moderna, hindi nila masasabi na hindi ka na pwede magkaroon ng COVID. Pwede ka pa rin magka-COVID. Okay? Because remember, we have lots of variants ng coronavirus and unknown pa silang lahat. Yung mga strains na yun, they are unknown. So, maybe in the future, magkakaroon ng vaccine o booster na lang yun pag nalaman na nila kung anong mutation, yung anong variant yung bago na meron tayo, no? Pero right now, kung ano yung vaccines that we have, they cannot promise that you will not be reinfected to COVID-19, but they can promise that you will have a strong immunity and then it will be less severity of the virus, all right? So, ano bang fate? The fate of the vaccine is that we cannot stop the transmission just yet, but we can stop the disease from manifesting in a severe way. And also, we have to bear in mind the herd immunity. Ano ba yung herd immunity, Doc? So, as you can see in the slide, no, it says here that no one is immunized on the first picture. And then, if no one is immunized, contagious disease spreads through the population. So, dumadami siya ng dumadami. Yung pangalawa naman na illustration, it says, some of the population gets immunized. Only some, no? At least meron na. However, contagious disease spreads through some of the population pa rin. But on the third picture, you can see most of the populations get immunized. So, the spread contagious disease is contained already kasi mas marami ng mas mataas or mas strong yung immune system nila. They get to fight the COVID virus. So, one best example here is that if I am not vaccinated, no, and then I have acquired COVID-19 virus, I am not vaccinated. Therefore, the signs and symptoms will be prolonged. Aabot yan for weeks, months pa. And then there will be a higher chance of transmitting it to other people. While if I am vaccinated, most likely, the signs and symptoms will be shortened. Maliliit na lang siya. Sa akin pa lang, patay na yung virus na yan. And then therefore, there will be lesser chance of transmitting the virus to other people. So that is how it works, no? Okay, next slide. Okay, so how vaccine works? A weak or dead form of the germ is introduced to our body, and then this sparks your immune response to develop antibodies, no? That remember the germ. Meron tayong tinatawag na memory cell kasi aside from the antibodies, may memory cells din tayo na kapag, say for example, first infection mo, sasabihin ng body mo, teka, parang may bago sa katawan natin. So that's where side effects sets in, no? And then, if the second time around na ma-infect ka na, since your body got memory cells and then you have developed antibodies, hindi na magiging ganun ka-severe yung effect or yung side effect sa'yo. Parang sipon na lang yan, mga parang trangkaso na lang yan eventually, no? So that's how vaccine works. Okay, none of the vaccines are live vaccines, okay? The only vaccines that are live is the MMR, if you are familiar about it, measles, mumps, and rubella, no? So, ang tanong nila, kapag nabakunaan ba ako, magiging positibo na ako sa COVID? No, it will not make you positive. Hindi iyon ang dinedetect ng RT-PCR and antigen, no? Most of the vaccine platform that was used here in our country is that they get a part of the virus and then inoculating it to the body to train the body to produce antibodies against COVID-19. So, it depends of the test. Some tests, they test for the actual presence of the virus. Ayun yung mga antibody. Say, for example, antibody titer against COVID-19, of course, kung nagka-COVID-19 ka, mataas yung antibody titer mo ng COVID-19 kasi na-acquire mo yon, no? But, if it is antigen, yung mga swab test na nakikita natin, RT-PCR, you will test negative because you got the antibody without the actual exposure of the virus, no? Nagka-antibodies ka pero hindi ka nagkasakit. Hindi madedetect ng antigen or swab test natin yung yung coronavirus na meron ka, if ever, no? Okay, next slide, please. So here, can a person be vaccinated using 2 different COVID-19 vaccines? Ito yung sinasabi nila na, sige, I will grab Sinovac muna and then afterwards, I want to shift into Pfizer, Moderna, or AstraZeneca. So, the answer here is that no, vaccine brands are not interchangeable at this time. No, wala pang studies na nagsasabi na pwede ka nang magkaroon ng interchangeability between the brands of the vaccines that we have. Kasi iba-iba nga ang mechanism of actions niyan. There is no evidence yet if there will be reactions or benefits if you will interchange administering the vaccines, no? But what the CDC advises is that same brand na lang muna. Maybe in the future, say for example, you already got your second dose, complete dose ka na ng vaccine mo. Maybe, who knows, it will be like flu vaccine na every year siya or every 6 months. Then, by that time, you got the chance to choose whatever brand you like, no? But at this moment in time, no, it is really important to grab whatever it's in front of you kasi it will really help you prevent having severe complications of the COVID-19. Kaya nga, kapag may dumadating na bakuna sa atin, say for example, sabihin nila na 600,000 vaccines, no, they count it as 300,000 lang kasi first dose and then the second dose. So, same brand yung ginagamit natin right at this moment, no? So, here, what is the probability that a vaccinated person will get COVID-19? Doktora, nabakunaan na ako. Magkakaroon pa rin po ba ako ng bakuna, ng COVID-19 kahit na nabakunaan ako? So, here, we have to take note that the first injection, hindi porkit na bigyan ka na ng first dose, okay ka na, well and good ka na. You can choose not to follow the minimum standard in the public, kailangan you have to practice pa din social distancing, wear face shields and face mask, hindi ka muna magkakaroon ng exposure to other people. Kasi the first injection, it is just an introductory. So you have patients must have to take note that upon getting the first injection, the first dose, no, your body, you have to help your body to recover first and try na give time for your body to recognize the vaccine muna. And it will take like 45 days for the antibody to mount para tumaas yung antibody mo, no? 45 days. And then on the second dose, pag nakuha mo na yung complete dose, which is ayun yung mas effective kasi complete dose ka na eh, nagkaroon ka na ng booster. Doon, you can only say that you got 100 times strong immunity only after 45 days, 1.5 months pa lang. But the antibody will start to pile up after the second week, no? So, ganun pa din, hindi porkit may bakuna ka na, hindi ka nasusunod sa mga protocols that we have publicly. We still have to follow natin yung yung bida, no? Bawal lang walang mask, sanitize ang kamay, dumistansya ng 1 metro, at alamin ang totoong impormasyon. Ganun pa din. Huwag tayong basta-basta maniniwala sa fake news na, uy, pwede na pala ang walang face mask, pwede na pala ang walang face shield. No. We really have, kung ano yung the best measure na gawin and precautions, yun yung gawin natin. Even if mahirap, so hand in hand, in order to fight this COVID-19 virus, really have to follow the rules that we have right now. Okay? So, wag maging kampante, still we have to practice the minimum public health standards, right? So, even if you already got the first dose of the vaccine, the second dose of the vaccine, hindi pa rin, no assurance nga yet na hindi ka na magkaka-COVID-19. Pwede pa din because the vaccines that we have right now doesn't cover other mutations, other variants that we have. We currently have 3 variants and those are unknown variants yet and wala pang vaccines na nade-develop towards that. Okay? So, here, we really have to adapt on the new normal, COVID-19 pandemic. It is really a new normal na you're gonna go outside being fashionably walking outside, wearing your mask, your face shields. That's the new normal. Okay? So, next slide, please. Okay, here. Talking about the efficacy of the vaccines, the one that I kept mentioning a while ago, no? Pfizer, Moderna, AstraZeneca, Sinovac. As you can see here, overall efficacy, primary outcome, magkakaiba sila, right? Merong 94.6%, 94.1%, 70.4%, 50, 78, and 65%. So, iba-iba sila. If you're gonna try to look on the efficacy of the vaccine, you don't look at it individually na, okay, Pfizer has 94% efficacy towards preventing COVID-19. Hindi siya ganun eh. Okay? You really have to look at 3 things. So what are those 3 things, no? First, is this vaccine will help me prevent the infection? Will you get the infection after the vaccination? How will it manifest? Gaano katindi? Magiging less ba yung severity if I got vaccinated by this brand? Mapapasa ko ba yung virus to another person? So from there, yung tatlong yun, ayun yung 3 questions that you have to address or tinatawag na endpoint of the trial ng vaccine eh. Ang isang vaccine ay effective kapag ito ay natulungan kang magkaroon ng lesser severity, hindi ka makakapagpasa ng virus sa ibang tao, at less likelihood or chance na magkaroon ka ng COVID. No? So here, the more important percentage that we have to look at, no, it is not the individual percentage of the vaccine. You really have to look at ilang percent ng mga tao, no, how many percent of the people, of the patients, ang hindi nakakakuha ng severe disease after being vaccinated. So say for example, right now, lahat halos ng ini-implement is Sinovac, no? So we have to get the percentage of the people that have been vaccinated by Sinovac. ilang percent sa kanila ang hindi nagkaroon ng severe disease. So that's how we look at it, no? Okay, kasi nga sabi ko, ang mga bakunang yan, pare-pares lang naman ng aim, which is to mount your antibody, give memory cells, and then eventually give you a strong immune system, no? Okay, next slide. Okay, so here, should those already have had COVID-19 get vaccinated? Yun yung tanong ng karamihan. Nagka-COVID na ako, does it mean I already developed memory cells? So here, CDC recommends that even if you already acquire COVID-19 virus, you are still entitled to be vaccinated, no? For as long as you have quarantine for 14 days and then you are asymptomatic by the time that you will get the vaccine, no? Studies have shown then na those who are infected by COVID-19 and then once they already got the first dose, there is 5 times more increase in their antibodies than those people or patients who got the full dose already or completed the 2 doses but without the history of COVID-19. So yung mga may sakit or nagkasakit na ng COVID-19 after they have survived it and then babakunaan sila pa yung mas magkakaroon ng stronger immune system, no? So parang if you come to think of it, parang trangkaso na lang siya, parang natural influenza virus, 'di ba, that we have every year kapag ka merong say for example, tag-ulan, nagkakaroon tayo ng ubot sipon. And then eventually nawawala siya for a week. And then by the next year, pwede rin mangyari yun ulit sa'yo. It's like that. It's how it goes. It's like influenza virus. That's why we have the flu vaccine to keep on boosting our immune system, right? So again, the answer there is that those who got COVID-19, they are eligible to get the vaccine as long as they have completed the 14-day quarantine and then they're asymptomatic by the time na babakunaan na sila. Okay? But what about those who got severe virus, as in yung mga na-hospital, nabigyan ng plasma convalescent antibodies, yung mga na-intubate? Sila, on the case-to-case basis, no? That's why we have screeners, physician screeners in the site of the vaccination to assess how strong the immunity of the person is. Kasi kung bagsak ang immunity niyan and based on the past medical history niya na talaga namang may asthma yan at ilang beses siya na-intubate, ilang beses siya na-hospital na-hospital, then hindi sila, parang they have to wait for 90 days pa. They have to allow the body first to recover and wait for 90 days apart prior getting vaccinated. Kasi otherwise, baka pag nabakunaan, ma-exacerbate lang or lumala yung condition nila, no? That's why we also don't give the vaccine to those who are immunocompromised, those who are taking immunosuppressant like steroids. Hindi natin yan basta-basta binibigyan ng bakuna. Kasi baka bagsak yung immune system nila and hindi makayanan ng katawan. Okay? So here, the next question that we usually got is how effective are the vaccines against newer variants? So right now, available data nowadays are those preliminary data pa lang kasi ongoing pa lang yung vaccination, di ba? So what we have right now is the preliminary data, Pfizer, Moderna, and AstraZeneca. Well, AstraZeneca is starting to AstraZeneca has preliminary data na that would show effective for those kind of variants, yung UK and African variants, no? Pero medyo matagal-tagal pa na studies yon. Okay? So Sinovac naman, hindi sila nagbibigay ng too much information, but Sinovac kasi works in a different way eh. It is a whole COVID-19 virus that is weakened and inactivated but cannot cause the disease. Theoretically, ang sinasabi nila, whole inactivated virus, mas resistant siya sa mga variants, no? Mas resistant daw. If it is a whole virus na ilalagay sa'yo na inactivated and weakened, mas resistant siya sa variants. But then, wala pang nilalabas ang Sinovac kasi na study about it, or hindi pa nila kino-confirm iyon, no? But theoretically speaking, that's how it works, no? Whole inactivated virus is more resistant to other variants than those na like other brands na part lang of the virus yung kinukuha. And then, sinasama nila sa ibang klase ng virus like adenovirus. Okay? So, as long as you practice public health standards like wearing masks, hand hygiene, facial distancing, you can prevent virus, especially if you are vaccinated. Mas higher yung chance na you're not getting the COVID-19. Period. Yun pa rin yun. That is the best pa din. The vaccine and then the public health standards. Alright? So, moving on. Okay, so we're now moving on to the special or vulnerable populations. Ito yung mga buntis, nagpapadede, yung mga bata, okay? So, first question is that children can receive the vaccine. Okay, okay siya for 16 years old and above kasi yun pa lang yung mga populations na ginamit natin for the vaccine. No published trials yet for the kids, no? No published trials for the kids. All right? Though ang Moderna, they are starting na. That's why it is important yung herd immunity. As you can see sa picture kanina, sa herd immunity, if everyone is protected, might as well you're also protecting your family or your friends, right? So how can we reach herd immunity? Approximately 70% of the population has to be immune to COVID-19, okay? So for pregnant women naman, you really have to consult your OB-GYN kasi case-to-case basis pa din yan, no? Depende sa past medical history mo. But if you're about to get the vaccine, you really have to wait for the second trimester, no? Para maiwasan yung mga fetal malformations, yan. Ayun na yung the best time for them to get the vaccine. What about those breastfeeding mommies? It is recommended because vaccines are not live. Those are generally safe naman talaga. And theoretically speaking, we pass our antibodies to our baby. So, mas maganda siya. No? I am pregnant. I cannot get the vaccine. So, you really have to discuss with your doctor. Kasi, when a pregnant woman makes a decision about the vaccine, she should consider the level of community transmission, personal risk contracting the COVID-19. Say, for example, I am a frontliner and I am pregnant, then therefore I need to get the vaccine. But if I have lesser exposure, then okay lang kahit postpartum na. I can decide. I can consider getting the vaccine postpartum pagkatapos ko ng mga anak. So, that is not an absolute contraindication if you are pregnant. Pwede kang magpabakuna, pwede rin naman hindi. So, it's a choice. So, is there any age cut-off? So, most of the evidence that are available right now, there's no limit hanggang sa kung hanggang saan yung age na pwede, no? But elderly, ang number one priority, they are A1. A2 naman yung mga, A1 are frontliners, A2 na tinatawag ay yung mga matatanda na, yung mga senior citizens, and then A3 are those with comorbidities. Okay? Sinovac, not really recommended for 6 years old and above because their studies are conducted to ages 15 and 49 years old. However, right now in practice, no, we are giving it already to the elderly people kasi nga there are rare side effects that would say na harmful yung Sinovac. Then again, it is always the benefits that outweighs the risk. Kung ikaka-benepisyo naman ng pasyente, then we're gonna be giving the vaccine na. Okay? So, AstraZeneca, kung bakit kayo nagtataka, bakit sa matatanda siya binibigay? Because yung data nila covers 6 years old and above. Okay? So, vaccine is a choice naman. Vaccine is a choice. There are some patient na gusto talaga nila Sinovac. Well, approved naman na ng FDA, so they can decide kung gusto nila. Basta the waiver states that walang study na nagsasabi na pwede ito sa 60 years old and above, but it is generally safe. However, the government has no liability to whatever might happen, no? But it is a choice. Science would tell na rare yung severe complications or severe side effect if you get the Sinovac for those, you give the Sinovac for elderly people. Okay? So, yun yung importance ng screening, yung mga physicians sa screening during the vaccination. Kasi they could assess if your immune system is weak, kung ano ba yung sakit mo, comorbidity mo, kung okay lang ba or hindi. So, marami rin nagtatanong na, ito, I have comorbidities with a lot of maintenance medications. I cannot get the vaccine. The answer is false unless you have an absolute contraindication to the vaccine. So, ang number one talaga, actually, number one is the elderly people, and then number two are those with comorbidities. Kasi sila yung pag nagkaroon sila ng COVID-19, most likely, hindi nila makakayanan yung effect ng virus. So, those, yung mga hindi lang natin pinapayagan are those with those immunocompromised, may mga HIV patient, but case-to-case basis. We have HIV patients din naman na nabibigyan na rin ng bakuna as long as they are stable, they are generally well, and then yung CD4 count nila is mataas, no? But some naman, if medyo 50-50, we would require them to have medical certificate, at least for their peace of mind na din na walang mangyayari sa kanila. And then their personal doctor have recommended that they get the COVID-19 vaccination, no? Another case din naman, we have yung may mga lupus nephritis. Hindi naman namin totally dinedefer or hindi binibigyan ng bakuna. If we see the patient na stable on current medications and very compliant sa medications niya, we give the vaccine pa rin. So, ang pinaka-absolute contraindication lang are those cancer patients na undergoing chemotherapy, radiation therapy, and those bedridden patients na talagang terminally ill na may taning na yung buhay, na talagang weak na weak yung immune system. Yun yung medyo nagdadalawang isip kami bigyan. Okay? So, people who should not get vaccinated, who should not get vaccinated. Ito yung mga tao na may severe, immediate allergic reaction, whether it is mild or severe to COVID-19 vaccine after the first dose, should not receive the second dose. Ito yung mga nag-anaphylaxis. When you say anaphylaxis, ayun yung nahihirapan huminga apart from the rashes na lalabas sa kanila. Hirap silang huminga, namamaga, nagkakaroon ng pamamaga sa mata, sa extremities nila. Ayan yung may mga immediate allergic reaction. Pero kung allergy lang naman sa seafood, paracetamol, penicillins, okay siya, safe siya. It is not an absolute contraindication. Okay? So next. Okay. I have allergies to other vaccines and injectable medication, therefore I cannot get the vaccine. False. You need further evaluation by an allergist. Kung talagang ikaw medyo nag-aalala sa kondisyon mo, may asthma po ako, talagang madalas akong mag-allergy. Doc, parang hesitant talaga akong magpabakuna. Then, we really advise to see your personal doctor o kaya allergologist, no? Kasi they could examine you, full examination, full physical examination, and then they will know your history talaga and background. Then, sila yung magbibigay ng medical certificate if you are recommended to get the vaccine. Okay? So, third naman, the potential of transmitting COVID-19 after vaccination, which is a very interesting topic. Okay? Next slide. Okay, reinfection. Decreasing COVID-19 transmission. Again, wear and practice them properly. Physical distancing, wearing a face shield, proper hand hygiene, wearing a mask alone. Especially if you really acquire the virus, no? Vaccine is not the only answer. It is just one of the many. So it's gonna be an holistic approach talaga. No, you get the vaccine at the same time you practice the protocols, okay? Can a COVID-19 vaccine make me sick with COVID-19? The answer is no, because it is not a live vaccine. So here, what are the side effects? No? What are the side effects? Karamihan ng mga tao or pasyente, the reason why they are hesitant is because sa mga naririnig nila na probable side effects ng mga bakuna. Diba? May mga blood clots, may mga hematoma. Yan, speaking of sabi naman dito, sabi naman sa studies is that there is only mild side effects after getting vaccinated, no? There is a lesser chance of getting side effects pa nga. Ang tawag dito ay reactogenicity, reactive immunity, no? If you get the vaccine and then you got side effects, mild side effects, it only means that the vaccine is telling the whole cells of the body na, oh, may something sa katawan natin na bago, therefore, may reaction. So, it is a reflection of how how strong the immune system is. Kasi if nag-react yan agad, ibig sabihin yung immune system mo is very active, is very strong, no? So, eto, Doc, iinom po ba ako ng antihistamine prior getting vaccinated? Iinom po ba ako ng paracetamol para hindi sumakit ulo ko? No. We don't actually prevent, but we treat. No, you only get to take those medications after you have experienced the side effects. Why? Kasi you have to take note nga na you really have to take note na kapag nagkaroon ka ng symptoms, ibig sabihin it's a good sign that your body is active. No, you got strong immune system. If you will drink yung mga antihistamine and paracetamol ahead of time, baka mamamask niya yung yung effectivity ng bakuna at saka ng reaction ng katawan mo. Okay? Are vaccine side effects related to efficacy? I did not experience any side effect. Does it mean that the vaccine did not work? False. Okay, in the clinical trials, side effects occurred at varying rates. Wide range, 1 to 20 for every 100 people had fever, but efficacy seen for greater than 90% of every 100 people. So many people will get the vaccine and not experience side effects, and this does not mean that the vaccine did not work for them. Depende yan talaga sa immune system mo. Okay? Okay, talking about anaphylaxis a while ago. So, yun nga, don't be afraid to be vaccinated or pumunta sa site because we have ready emergency medications naman in case you'll have anaphylaxis right after the first dose or second dose. But right at this moment, wala naman pong nababalitaan na right after the vaccine, may na nag-anaphylaxis na. So, basically, our vaccine that we have right now are generally safe for everyone. Pwedeng-pwede siyang i-administer, okay? Okay. So, before I end the discussion, so we have to bear in mind that we have to imagine that we are all in that sinking ship, no? May lumulubog na barko at lahat tayo, we are trying to save our lives, not to get drowned. So, ganun din sa COVID that we are facing right now. If binigyan ka ng salbabida, hindi mo na kailangan maging choosy pa. You have to grab it right away for you to float at hindi ka malunod. Ganun din sa COVID ngayon. If kung anong vaccine ang ibigay sa you have to grab it right away. Otherwise, baka maunahan ka ng COVID virus. Magkaroon ka ng severity of complications. Tsaka ka lang magsisi sa huli. Okay? So, let us bear in mind na we have to help each other hand in hand. Let's work each other hand in hand. Let's try to encourage our families and friends to be vaccinated so that we'll get to target the herd immunity na sinasabi natin, no? Okay, kakayanin ba namin ang adverse effect? Baka lalo kaming magka-COVID. Again, maraming magsasabi na after the first dose, wala namang naramdaman. After the second dose, tsaka lang may naramdaman. So, it is normal. Actually, it is normal for the vaccine, no? Kasi, yun talaga yung niya. It is one way for the body to recognize the vaccine. And then, ayun yung magbibigay ng strengthen your immune system. Okay, how many days before we get the immunity? Yun nga, as mentioned a while ago, you will only get the full immunity or strong immunity after you have completed the second dose. So, after the second dose, 2 weeks after that, tsaka pa lang magpa-pile up yung antibody mo, and then, magiging 100 times strong yung immune system mo only after 45 days. So, wag muna tayong magkaroon ng high exposure, less pa rin yung exposure natin sa labas, and still practice social distancing. Okay? So, this has been tackled earlier already. Okay, what are the long-term side effects of the vaccines? No? So, wala namang long-term side effects ang vaccines natin. Walang ganon. Kaya nga tayo nagbibigay ng booster di ba? Kasi transient lang siya. Hindi ka magkakaroon ng blood clot forever or after 3 months magkakaroon ka ng blood clot. No. Kasi eventually, yung vaccine na binibigay sa atin, it will slough off. Nawawala din siya. After magamit ng katawan natin at nagkaroon na ng mataas na levels of antibodies, nawawala din yan, yung mga binibigay sa atin na inactivated virus. Okay? So, face it, masks save lives. Whether you are vaccinated or not, you really have to wear your face masks, face shields, practice social distancing. Taste lang after maybe a year. Ang target natin, 2022, di ba? Maybe we'll get to do what we used to do way back in 2019. Okay? So that would be all. Thank you so much and God bless. Thank you for listening. I hope you have learned a lot about this talk and I hope that you encourage your families and friends to be vaccinated, to get whatever the brand of vaccine it is. They have to grab it. All right? So thank you so much. Thank you to Filta for having me. I
Of
hope
course.
everyone
Yes.
have learned a lot during this session. Okay?
Thank you, Dr. Hershey. Again, any information, especially with regards to these types of questions, clarifications, food for thought, it's very helpful, no? I mean, like you mentioned earlier, maraming news, a lot of sources, a lot of
Yes.
specialists bigla. So thank you again
That's
for
true. That's true. Especially Dr. Google. Google is there to look for a doctor. Kung pwedeng pwede ka magpaka-teleconsult, no? But it is
Correct.
not a doctor kasi hindi naman nagpunta si Dr. Google sa med school.
Yep, exactly. So for everyone who joined us tonight, if you have any additional questions for
Yeah.
Doctora, feel free to give her a call or reach out to her. Doc, would you like to add anything or say anything else aside from your teleconsultation? How
Well,
else can they reach you?
I'm just very grateful that for this opportunity that we're able to educate a lot of people and then eventually encourage them to be vaccinated. Kasi ang dami pa ring pasyente na very hesitant, in the site. We are meant to schedule like thousands of people and then only half will come to us for the vaccine. Hindi lahat pumupunta kasi some are still waiting for specific brands, no? But then again, sabi ko nga kanina, kung ano yung meron, yun yung kuhain. Otherwise, baka maunahan ka ng COVID virus, tsaka ka pa magsisi sa huli. Kasi pare-pares lang naman ng efficacy yan. Vaccines are meant to prevent you from having severe complications. Pare-pares lang. Okay?
Thank you. All right, perfect. Thank you so much, Doc. Again, the available vaccine is the vaccine, as
Yeah,
mentioned.
it's the best vaccine. That's the best vaccine. Whatever is available, that's the best vaccine talaga.
Thank you
Okay?
so much, Doc. Thank you so much for your
Yeah, don't
time.
forget also to get your flu vaccine and pneumococcal kasi ang number one shield talaga natin aside from the public yung minimum standards protocols and the vaccine that we have is our resistensya. Yung immune resistensya talaga natin, no? Merong mga bata, younger people who got severe COVID yung hindi nakaka-survive. Pero meron din namang matatanda na very active, nag-exercise talaga and have acquired severe COVID pero nakaka-survive. So it's only yung resistensya nga natin, yung shield talaga natin right at this very moment and nowadays, no? Yun lang. Okay?
Thank you,
Thank you so
Doctora.
much. Thank you.
Yep. All right. Once again, certificate registration link will now be provided in the comment section. Please remember they will be open until 8 p.m. Now for job openings, again, we are looking for digital marketing specialist, CGI designer, FB ad specialist, developer, designer, and digital marketing specialist, feel free to visit our website at www.filtaglobal.com/careers. Again, thank you so much for joining us. We encourage you to post their certificates on LinkedIn and tagged at Filta Careers. Don't forget the hashtags that we'll be showing in the banner comment section. Filta, hashtag Filta. Use the hashtag FiltaFam and hashtag start with Filta. So now you will see as well how the certificate will look like. Again, for those who would want to join the family, very curious on looking at for new opportunities. So so like we say, if you hate your job, go to Filta, have a look at our available opportunities now for you. We would love to have a conversation. But for tonight, again, thank you so much for joining us, Doctora. Thank you. Everyone, stay safe, stay in good health, and we look forward to seeing you soon. On Friday, we have another Filta Facebook Live event, and there will be more to come. Thank you so much for joining us. See you till next time. Bye-bye.